This is the University of Sheffield Health Service podcast on sexually transmitted infections. We'll first go through what is covered in this podcast. We're going to briefly discuss about sexually transmitted infections, how to access help and advice, the chlamydia screening program, and other services who can help. So, what are sexually transmitted infections? As the name suggests, these are infections transmitted through close sexual contact. They can be transmitted through any means of sexual contact, that is, vaginal sex, oral sex, or anal sex. Prevention is always the best cure. If left untreated, they can cause long-term complications like infertility. Remember, most STIs can be prevented by using condoms. Now, what are the common symptoms of sexually transmitted infections? You may not notice any symptoms at all. The most common symptoms are divided into symptoms in men and symptoms in women. We'll go through the symptoms in men first. People may notice itching or soreness on the penis, pain when passing more urine than usual, discharge from penis, and pain during sexual intercourse. The common symptoms in women can range from unusual vaginal discharge, irregular periods, pain during sex, painful or frequent urination, bleeding after sex, soreness or blisters near vagina or anus. Let us first go through a few important points about chlamydia. It is the most common sexually transmitted infection in the United Kingdom. More than 1 in 10 sexually active 15 to 24-year-olds are affected by chlamydia. It can be completely symptom-free. Long-term complications of untreated infections involve infertility, ectopic pregnancy, which is a pregnancy outside the womb, and pelvic inflammatory disease in females. In men, it can cause reduced sperm quality and quantity, painful and swollen testes, and arthritis. So, what is the chlamydia screening program? It offers confidential and free chlamydia screening and treatment to all young people under 25 years of age. If you're over 25, please see a doctor or nurse for a free chlamydia test. Test kits are available in all the toilets at the University Health Service, or ask a member of staff for one. The chlamydia test involves checking the first void urine sample or the first part of the urine sample. In case of females, a vaginal swab can also be used. You can choose to be contacted about the results by phone, text, or mail. It is an extremely confidential service, and they can also help you with contact tracing and treatment. Other examples of sexually transmitted infections include genital herpes, syphilis, gonorrhea, human immunodeficiency virus, or commonly called HIV, certain types of hepatitis infection, trichomoniasis. So, how can we help you at the University Health Service? The University Health Service is mainly for the Sheffield University students and other people registered with our practice. It offers male and female sexual health clinics. We offer free sexual health advice and treatment. We can do full and partial sexual health screens. We'll discuss about this in detail a bit later. We offer contraceptive advice and advice on emergency contraception, morning after pills, etc. We also can provide a fixed number of free condoms. For our opening times and contact details, please check the following link: www.chef.ac.uk/health. Let us now discuss in detail about what happens in a partial and full sexual health screen. A partial sexual health screen involves checking first void urine sample or vaginal swab for chlamydia. First void urine sample is the first part of the urine you pass, and make sure you haven't passed any urine for at least 2 hours before you do this sample. Urethral swabs are taken for bacterial and other fungal infections in men. Internal examination and swabs are taken in women. Please discuss during the appointment if you have any unusual testicular lumps or vaginal symptoms. A full sexual health screen involves all of the above tests and blood tests to look for HIV, hepatitis, and syphilis. You can choose to have all or some of these tests. Please remember, the blood test for HIV or hepatitis may be negative for 3 months after the exposure. So, who should get tested? Anyone having symptoms discussed before, anyone starting a new relationship, if you're worried about unprotected sex or needle stick injury, intravenous drug users should get STI checks regularly. We'll now look at what other services can help you with sexual health related information in Sheffield. The Sheffield Genitourinary Medicine Clinic, or GUM Clinic, is based at the Royal Hallamshire Hospital. Please ring them first to make an appointment. The Sheffield Contraception and Sexual Health Service and the Sheffield Chlamydia Screening Program, they're all based at the Central Health Clinic, which is in the city centre. Please make an appointment before visiting them. You can also attend the 2 walk-in centres in Sheffield, which are currently open every day from 8 a.m. to 8 p.m. You can get information about where they are located by following the link. Please note that you can now watch all our podcasts on YouTube using our YouTube channel and get regular updates about the University Health Service using Twitter. This is the end of the Sheffield University Health Service podcast on sexual health.